The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices as wish our friends at WHBC and our listening audience continued good health. Our guest today is Chris Fogarty, psychiatric and mental health nurse practitioner at Mercy Medical Center. So Chris, welcome back to the show. Thanks for joining us again. We're looking forward to talking to you today.
Thanks for having me, Paul. Brad, I appreciate you having me back on the show. Looking forward to it.
You are not alone. These are powerful words. It's important to measure how common mental illness is so we can understand physical, social, and financial impact. So we can show you that no one is alone. 1 in 5 U.S. adults experiences mental illness each year. 1 in 25 adults experiences serious mental illness each year. 1 in 6 U.S. youth ages 6 to 17 experiences a mental health disorder each year. And unfortunately, suicide is the second leading cause of death among people aged 10 to 34. Most people who experience mental health problems fully recover, or they can live and manage them, especially if they get help early on. But even though so many people are affected, there is a strong social stigma attached to mental ill health, and people with mental health problems can experience discrimination in all aspects of their lives. This morning, we're going to talk with Chris about mental health initiatives in our community and reducing the stigma attached to mental health conditions. We'd like to remind our listeners that you can get our show on our podcast. Just go to the App Store on your smartphone and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate it if you'd subscribe.
And Chris, welcome back to the show again, and tell us about yourself and your background.
Well, thanks again for having me. As you said, I'm a board-certified psychiatric and mental health nurse practitioner. I provide evaluation and care for mental health patients across the lifespan. I see both adults and pediatric patients. I've been with Mercy now for over 7 years, actually just coming up on my 7th anniversary. I started in the ICU as an RN. Then I realized that there was a need for some psychiatric care, so I moved to the emergency department where I was for 3 years before becoming a nurse practitioner. And so I practice in several of our outpatient offices. I previously taught for a couple years at Walsh in their nursing school as well, and my wife and 7 kids and I live in Plain Township. So
Wait a minute, how many kids?
we're expecting our 8th.
Oh my gosh, you're kidding me.
Yeah. So we are very invested in the health of our community because we're building the future of our own children. So
Do you get any rest in that house? Their kids?
Yes.
What's the age spread on those children?
My oldest is 14 and a half, and she'll be a freshman in high school this year. And our youngest is 3 and a half. And of course, we're expecting one at the end of the year. So I take very little credit. It's my lovely wife, Monica, the resident state in the household, that is the glue that holds it all together. So
Wow, how nuts.
we have a lot of fun.
Well, I see the psychiatric health, mental health field as a tough one. So what made you get into that?
Well, like I said, I worked previously in the ICU, and at Mercy, we regularly place psychiatric patients in the ICU for monitoring, depending on the need. So if there's an issue of self-harm, violence, needing more close care, because we don't have a psych unit at Mercy, they'll sometimes end up in the intensive care unit. And so as an RN, I kind of went through nursing school, was worried about mental health rotation and what I would see there, but I actually really enjoyed it. And then when I got into critical care, I realized that I actually enjoy working with those psych patients. And so after some thought and prayer, I decided to make the switch. So I wanted to be able to help patients prevent that from happening, from having to be in the acute setting with something getting that bad. So I moved over to psych triage in the emergency department, which was a great experience. Of course, now I work primarily outpatient. So it was really seeing the need in the community.
Let's talk stress. What is stress?
Stress is one of those.
Some people really get stressed, and some people just don't.
You're right. It's amazing. Stress is, it depends on your perspective. There's a lot of ways to look at it. But generally speaking, we use it to describe something, whether it's external or internal, which causes an individual or a thing to adjust in some way. I like to describe it as like a bridge. If you look at a bridge, you have a really heavy truck rolling over it. If the truck, the bridge has to hold it up, but if the truck is too heavy, the bridge could break. So stress is that thing which makes us adjust in some way. Sometimes we don't see it. Sometimes we have capacity to handle it. Like you said, some people respond, they don't seem to let stress get to them. They're adjusting, there's an internal adjustment, but it's processing the stress. And others, stress can overwhelm them. It really just depends on the individual person.
People, you know, there are, as you say, there's individuals who just go out of this world for certain small things, you know, stress them out. There's a lot of other people that just handle huge, you know, tasks and huge this and,
Right.
and things in their life, and it's almost difficult to believe that there's that much of a difference between people.
Well,
how about
right.
How about genetics? Is there something with genetics then?
Yeah, we do know that there are genetic links to issues like anxiety. The ability to cope with stress involves everything from your life experience to internal health disposition, to learned behavior. So there's, like I say, you could have 5 different people looking at the same problem and having 5 different viewpoints and reactions. So it really depends on all those things, both outside us and inside us.
Instead of asking this question, is stress a bad thing? Is stress a good thing?
Stress can be a good thing. I used to tell my students at Walsh, here's the difference between stress being good and stress being bad. A good stress is you wake up on Wednesday, realize you have a test on Thursday, forgot about it, and you go study. Or you get a gas bill. That's a stress. Like I said, stress causes us to change. When you get the gas bill, the change is that your pocketbook should be a little bit lighter. But the positive aspect is that you keep warm in the winter. Stress, when it becomes overwhelming, and certainly we see that. So I guess it's a complicated answer, Paul. Some stress is good. It's what allows us to move forward and adjust. But stress can be overwhelming, and when it harms the person, that's when I would say that it's bad.
I'm certain that you've seen this, that stress can affect physical health.
Oh, absolutely. Yeah, stress actually activates systems in our body that are meant to help cope with acute stressors. People have probably all heard of the term fight or flight, and the example I give with my patients is if you're in the woods and a bear crosses in front of your path, you're going to have a lot of physical responses that start in the brain and activate the body's ability to survive. And we have that in a similar way in our body with stressors, that the body and the mind have to cope with that. But over time, persistent stress, untreated stress, can actually contribute to health issues like heart disease, diabetes, obesity, because of that persistent change. The stress is not meant to be, the fight or flight mode, so to speak, is not meant to be continuous in our body. So untreated stress can lead to negative downstream effects. And so we want people to be able to manage that before it affects their health.
So stress can trigger hormonal issues?
Absolutely. Yeah, so you have some hormones like the cortisol in the body. And on the same token, there are hormonal changes that can affect our ability to cope with stress. And life changes, people's where they are in life, whether you're young or old. It's kind of a back and forth relationship between health and the ability to cope with that stress.
Okay, Chris, our first break's here. You're listening to Health Matters with Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Chris Fogarty, psychiatric and mental health nurse practitioner at Mercy Medical Center.
All right, Chris, we talked a little bit about how stress can affect physical health before the break. What about your physical health or maybe a medical condition? How can that impact your mental health?
Great question. So we know that some illnesses like heart disease have a proven increase in mental health issues, particularly depression. For instance, patients that have heart surgery often have associated depression following that, and that's been shown in a lot of research. But there's also the mental stress of a chronic illness, whether it's yourself or a loved one, that can lead to issues like depression if you're dealing with a cancer diagnosis or a chronic illness like diabetes that can affect that mental health. And as I said before, there can be an internal, that whether it's a hormone shift or something going on metabolically, but it can also just be the natural stress of this illness is affecting my quality of life. It's affecting my ability to move and get around, do the things I want to do, that can be stressful, and that can lead to the onset of mental health issues.
What about the difference between stress and anxiety?
Well, there is a difference. So like I said earlier, stress itself isn't always a bad thing. So stress can be a motivator to improve, can be a motivator to change. I'm watching a documentary right now on Michael Jordan, and every time he would lose a game, that was his stressor that motivated him to get back out and score more points and win more games. So, there's different motivators, like I said, the gas bill, et cetera. But when stress leads to excessive worry, anxiety is the mind looking at a stressor and having what we call a fear response that's in excess of the stressor itself. So it's looking at whatever that stressor is and having a response that's not adaptive, it's not coping with it appropriately. And so excessive or clinical anxiety would be the mind playing up that risk to itself, that fear response in an excessive way. And so that's kind of what we work at on anxiety from a cognitive standpoint. We try to address the way that the brain or the mind looks at those stressors.
So does anxiety always appear as maybe that feeling of panic or worried thinking, or are there other symptoms or things that anxiety can take form in?
Sure. Well, it doesn't always look that way. I think some people think that anxiety means that I'm a worrier, or I have moments where I'm panicked and I get those classic symptoms of racing heart, hyperventilation, et cetera. But it doesn't always look that way. It can affect things like sleep. It can increase irritability. It can cause a person to overthink issues, like ruminate on past conversations, or feel like they have to exert more control. I mentioned that anxiety is the brain's response to a fearful stressor, and so sometimes the brain says, I need to be able to control things, and if I feel out of control, then it can lead to anxiety. So no, it doesn't always just look like worried or panic. It can look like that. There's also some physical symptoms that can be experienced, like abdominal issues. If you feel a racing heart now and then. Now, I always tell patients, if you have physical symptoms, you want to talk with your physician. We always want to rule out a physical diagnosis first. But if there are physical symptoms of anxiety that we don't find any underlying issues, it could be a sign that you have anxiety and it's manifesting. The brain is kind of manifesting that with physical symptoms. And so those are some of the things I look for as well.
All right, let's talk about the pandemic and COVID-19 with increased mental health issues in the U.S. What types of concerns are increasing that you're seeing?
Well, I've seen a couple studies recently. The one that really struck me was the rate of depression and anxiety in healthcare providers. As you can imagine, that's a big thing, and I know I'm grateful to our Mercy team for all that they do to protect our healthcare frontline workers. But at the same time, we know that there's a risk, and so that can contribute to anxiety, increased depression, and we're seeing more people seeking help during this time. And that also goes for across the population, the general population. I was reading last night about, I might misquote the numbers, but I believe it was somewhere to the tune of 14 or 16,000 new reports per week across the country of depression or anxiety, which is quite a spike, as well as increased risk for psychotic disorders, which are thought disorders. And if stress has this pernicious way of increasing risk across the board for mental health issues. So certainly, like you said, Paul, going to the grocery store, you see people with masks, you worry about getting that. Everywhere we look right now, we're worried about something. So I would say that across the board, people are more at risk right now.
Do you think it's as easy for people to get care right now as it was before the pandemic? I get the impression that we hear patients in the store that are a little, it's an adjustment to just do the telehealth visit. Or can you help someone with a mental health concern as easily over video as you could live in person?
Well, I think that's a twofold answer. I think most practitioners that you talk to would ultimately prefer to have in person. And me personally, I have a combination of both right now. I'm seeing patients in office as well as telehealth. Of course, we're still using strict safety precautions. But at the end of the day, I would rather see a patient virtually with audio and visual through the computer than not at all. And I know that some people that's a holdup for them, and it depends on the individual whether they're comfortable. But the fact that we have that, it certainly has caused some hiccups in the system. I can't say that we have more. I think we have more need. I don't know that we have a corresponding level of care, but I guess the short answer is it's available and it's better than nothing.
Sure.
Okay, we got to take a break here. It's the bottom of the hour and time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters. We're talking today with Chris Fogarty, psychiatric and mental health nurse practitioner at Mercy Medical Center. So, Chris, what are some of the signs that stress is starting to affect your mental health?
Yeah, that's a really pertinent question, especially in the age of COVID. There's a number of things that I would recommend people watch for. First of all, anytime we have excessive stress, like I said, sometimes we have to adjust in some way, whether it's we have the internal ability to kind of handle that stress or whether we have to make a change around us. But our body copes in some way. So we want to look for things like sleep changes, sleeping too much or too little, increasing our use of like alcohol or tobacco or using illicit drugs, having appetite changes, eating too much, too little, changes at work, feeling like you can't get up and go into work in the morning, or you're not getting the enjoyment out of it that you used to. Starting to look at yourself with maybe devaluing yourself and what you do, whether it's with your family, at work. And a big indicator, I think this is one of the things that as a provider I really look for is what are the people around me noticing? If somebody's saying, "Hey, you doing okay? You seem down, or you seem off." Usually, some of the people that notice how we're coping are the ones around us that know us best. Sometimes looking at ourselves is the last thing that we see. So those are just some of the things, but it's individual to person. Everybody, again, reacts differently.
Statistically, I've heard that alcohol consumption has increased. And being an expert at picking up cigarette butts in the parking lot, I see that the cigarette butts have increased too. So we're definitely, my little home study here says that they're smoking more. So.
Yeah, a friend of mine says, like to say, I've adopted this quote that the plural of anecdote is not data. However, I think that when you get enough cigarette butts, that becomes data, right? Yeah, I think that we have seen an increase in that, and I've seen that with a lot of patients that have increased their use. And it's like I tell them this is a method of coping. It's the maladaptive method of coping. So we want to replace that with more positive coping methods.
What about weight increase, body weight increase with this consumption? You know, more people kind of sitting around and eating more and going through the drive-through window more and all that sort of thing. That seems to me.
Yeah. I think my spare tire size went up a couple inches over the last 5 months, and that's just yeah, I think that's across the board. It's a matter of a combination of stress eating and the nature of being at home too much. So
Sure.
I think it's important to take care of ourselves and get off the couch, get outside, etc.
Exactly. Okay, so what are the signs or symptoms indicating someone is experiencing anxiety or depression? You've already covered part of this, but anyway.
Yeah, well, some other things that I think it's important to look out for specifically for this is some of the heavy hitters, particularly for depression, are if you're feeling low, if you're feeling down or depressed, if you no longer enjoy the things you used to do. Like, gee whiz, I used to enjoy fishing, and now I just don't get any enjoyment out of it. I used to play crossword puzzles with my spouse or my friends every day, and now I don't. If you start to notice those kinds of changes, big warning signs would be thoughts of death or suicide. Like you said earlier in the program, Brad, that's suicide is the second leading cause of death among young adults. So if we start to see that, that's very concerning. Again, for anxiety, irritability, if you have trouble kind of getting at your head around worry, or feeling overly anxious about things that you normally wouldn't feel anxious about, are signs that you may be experiencing that. So just, again, this is not an exhaustive list, but I just encourage people out there to, if you're feeling something that just doesn't feel normal or feel right, that may be a sign that stress is starting to become a little bit more overwhelming.
We're hearing a lot of things in the news about people enjoy being off work and getting the extra money, and then you also hear the other side of this, that a lot of people really wish they could go back to work, and there's just no jobs, I guess. So we're kind of hearing for many categories of folks, maybe unskilled labor, whatever. So
right, you're absolutely right, Paul. I've heard a number of people say, I feel like I've kind of lost my purpose without having a job, and it's both people that have been laid off temporarily and people who have lost their jobs indefinitely. People do get a sense of satisfaction and purpose from where they're contributing, and when that's taken away, that can really affect them.
One of the surprising areas initially, and I think it's changed, was healthcare workers, because they weren't doing elective surgery, and a lot of surgeons and assistants and aides and all that sort of thing got laid off, or whatever the other thing is called, I forget. But they still had health insurance, but they didn't have any money coming in. So
right. Yeah, that was fortunately, I know at least in our system we tried. I believe we tried to shift some personnel around to fill these extra duties with screenings, etc. But that didn't fill all the gaps, and fortunately, they can get unemployment, etc. But it's not the same. So.
Yeah, sure.
Chris, are there other mental health concerns that are also more prevalent in this time of COVID-19?
Well, Paul just mentioned one of them, stress from loss of income. That certainly is a big one. Um, Loss of a loved one. If you have someone who that has died, or even somebody that is at high risk, or has other underlying health concerns that put them at higher risk for death or serious illness from COVID. So it's an important to keep an eye on your loved ones as well. What are the people around you experiencing, and how are they being affected? And is their mental health at risk? We can be, as I said earlier, I look to the report of friends and family, and so I would say, just like we want to listen to others' words, I recommend people watch out for those around them. Are they suffering, or are they overly stressed?
All right, so let's say we have a listener right now that's hearing the message you're sharing and they feel like they are overwhelmed by stress or anxiety. Do you have some tips or recommendations for them to get themselves in a better place?
Absolutely. So if the first thing that I would say is, if you're feeling overwhelmed, if you have somebody that you can talk to, a family member, a trusted friend, talk to them, let them know what's going on. Have somebody that's in your corner there. If you're connected with a physician, contact your physician. They can talk to you. They can make recommendations. We don't want you to feel like you're alone. We also have a great service here in town called Crisis. It's run by Coleman. They're a 24-hour service, and if you're feeling overwhelmed, they have 24-hour access. Their number is 330-452-6000. That's 452-6000, and they just do wonderful work. They'll talk to people any time of the day. And of course, if you feel like you're feeling overwhelmed and you need guidance, that's what folks like me are in the business for. You can always give me a call, and I'd be happy to help you out in any way that I can.
So, something that's interesting, I think, depending on the type of maybe person you are, maybe the type of life you lead, you may have different methods built in to cope with stressors. I get the impression from seeing and talking to patients in the pharmacy, there's people that have a lot of stress and depression or some mental health concerns, and they internalize it and kind of keep it all in and try to deal with it themselves. There's the section of people that don't think any of that exists and can't understand why anyone has a problem with it. And then there's the people in the middle who are actively trying to seek help, and aren't shy about telling you that they have a problem. So I think that with the stigmas we've talked about, it's really interesting to see different types of personalities and how different people cope. What can you say to people in each of those categories with respect to maybe how you approach your day when maybe, for the lack of a better way of putting it, your buttons are getting pushed, if you will?
Yeah, well, that's something that we talk about. It's a broad question for a specific answer depending on the individual. But I think if we're looking at it from a big picture, looking at those three categories you mentioned, if you have the type that they can kind of simply compartmentalize it and move on with their life, or let it run off their back, so to speak, then I think that can be healthy, as long as they're not letting it bottle up to the point where it overwhelms them. If you have somebody that's open about their stress and says, yeah, you know what, I'm stressed out all the time, and they're very open, that can be good until it starts to overwhelm the people around you. Sometimes if we talk about our stresses all the time, we can kind of become blind to how that's affecting the people around us. So kind of channeling that through the appropriate ways there. And then there's probably some that don't think that this is an issue at all. And I would just say that stress is, it's there for everybody. And if you think that it's just, you can just think it away, some people can, some people can't. And so we talked about the brain and how it kind of sparks that fight or flight. issue. Everybody responds to that differently, and so I think the most important thing though is that if you think to yourself, you know what, you should just be able to get over that. The person you're thinking that about probably doesn't feel that way. So if you're out there thinking, oh, my friend should just be able to get over it, or kind of think it away, this is probably something that's deeply affecting them, and their actions or their responses may be a call for help.
What should be, I don't know, probably we shouldn't even ask this question, but we have so many antidepressant medications out there, okay? And is that in a beginning treatment for the average depressed person, or what's the beginning here?
Well, the first thing we always want to do is determine what the level of need is. Using an antidepressant medication can be helpful, but it's not always the first step. As a nurse practitioner, my role is to listen to what their need is and make recommendations. So we don't just prescribe, and I'm very grateful for folks like both of you that help us with in the medicine side, and I'm sure you would agree that medication is not always the answer. So I'm very much about counseling on the way that people approach stressful situations, the fact that this or that stressor may be worsening their anxiety, and how to cope with that, or sometimes even avoid it, etc. And then if depending on the severity of it, medication can certainly be helpful for things like depression and anxiety and the more serious thought disorders. But never as a single solution. It's always in the context of what else are we doing in our life to help reduce stress, get along better, enjoy our surroundings better.
Interesting. Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We are talking with Chris Fogarty today from Mercy Medical Center.
All right, Chris, what are some of the things we can do to reduce stress?
Well, there's some practical recommendations I tell everyone, and those are some pretty well-known things like exercise, diet. So walking's a big thing I recommend, getting out and being active. Prayer, meditation, and mindfulness are important. Just taking time to be mindfulness is all about seeing where you are right now and what you can control. Talking with friends and family that are supportive. And if you have medical conditions, I always say make sure you're talking with your physician and adhering to their medical recommendations so that we don't have those issues compounding your stress as well.
Okay. What should someone do if they're concerned about the mental health of a friend or a family member?
Well, again, I would talk to them first. I would let them know, or ask them how they're doing, and if they are overly concerned, make that call to their primary care provider, or again, if you're very concerned, call crisis, or even take them to the emergency department if it's acute. And then if all else fails, they can, or hopefully before that, they want to give me or somebody else a call and get in to be seen.
You know, what kind of falls into this question category is what do you do about somebody you think is over medicated?
Over medicated?
And another part of this is someone who's drinking too much. Okay, I'm certain you know how difficult it is to communicate with someone who's consuming too much alcohol.
That's very concerning for family members, especially if it's affecting their wellness, their daily life. For people who are abusing substances, whether it's alcohol or an illicit drug, et cetera, I would say do what you can to help them. Understand that we can't control everything, right? We can't exert complete control over their behaviors. It's be supportive and available, and if you're concerned about their safety, that may be a time when you want to call for something. Their well-being.
And do we refer people to someone in your practice?
Yeah, so if they want to, I'm actually located in 3 different locations. If they want to come and talk to me, I'm at Mercy's Pain Management, where I'm located right now here at Mercy Medical Center. I'm also at Jackson, at our health center over there in their pain management. I also see patients at St. Paul Square on the northeast side of Canton. So if they want to call me, they can either call for an appointment at 489 1362. That's 330-489-1362. Or they can go on cantonmercy.org, and under services, they can click on mental health services. I want to make sure that people are aware that if you're feeling like you want to be seen, but you're concerned about going out right now, I do have virtual appointments available. When you make that phone call, you just let them know that you want to have a virtual appointment, and we can sit down and talk in a setting similar to this.
Are you seeing people in the office environment too?
I am. I'm seeing both. So if you come into the office, you'll wear a mask. We'll sit a socially appropriate distance apart, and we can see that way. I try to make sure that we provide an opportunity for what's most comfortable for the clients.
Well, a heck of a lot of people who just don't like Zoom and you know, I forget what some of the other devices that are hanging around and they're using now. So.
Yeah, the good news is it's very easy for the virtual appointment. You don't have to have a particular app. It's web-based, so if you have a computer or a smartphone, we send you the link, you click it, and you're right in my waiting room. You just enter your name. So it's easy to access, but I understand people sometimes are more comfortable in person.
Are you finding that older folks are adapting to the Zoom type?
By and large, yes. I was uncertain when we first started this back in April how across the lifespan, but I have to say that by and large people have adjusted quite well, and there's not a real preference by age. It just depends on comfort level, but people have adapted really well.
Do you need a referral to get an appointment with you, Chris?
No, you don't. Your doctor may refer, if you're talking to your physician, they may want to refer you to me, but it's not required. So if you're out there and you say, I want to start by just talking with you, with me, they can make the phone call. You don't need a referral. They'll make an appointment. It'll take care of all the insurance stuff behind the scenes there, but I'd be happy to talk with folks that would like to talk more, have concerns, and please don't hesitate to make the call, go online. And, I'm happy to talk with as many people as I can. And there's other agencies out there that are doing great work. Stark County has a lot of great folks doing that. So please, if you feel like you need help, don't hesitate. We want to help you.
Are you not sort of a pioneer as a nurse practitioner in this sort of care? And typically in my career, I remember we had numerous psychiatrists and psychologists in this marketplace, and I don't think we have as many as we used to have. Is that correct?
There are less physicians going into psychiatry. So the behavioral health, the mental health nurse practitioners have started to increase to fill that void, and so it's a much needed position. But we don't work alone. So we work with psychiatrists and psychologists and counselors, et cetera, but as a team to try to meet the individual needs of everybody. But it's rewarding and challenging, and I'm very happy to be in this field.
Yeah. Have not both hospitals here in town closed their psychiatric wing in the hospital?
Yeah, Altman, they closed a couple years ago, and Mercy, it's been probably 7 or 8 years since they closed. So unfortunately, we don't have that available in the hospital, but there is a inpatient independent hospital opening downtown. Currently, they're in the process of opening up in phases, so we'll have something in camp.
Okay, thanks very much for being with us today. Chris Fogarty,
Thank you.
psychiatric and mental health practitioner at Mercy Medical Center. I'd like to remind our listeners, if you suspect you have a medical issue, please contact our healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.